Hello everyone, please come up with your queries. Question number 16. Question number 16 is that the patient has come to you with DUB. I think that is the question, yeah. Sorry, all regarding puberty menorrhagia is true except. Question number 16 is all is true regarding puberty menorrhagia except. So here you have to see that in the puberty we cannot do DNC unless and until it is life threatening. Only in the married woman we can do DNC. Okay? Unless and until it is life threatening, we cannot do puberty. First of all, the main reason is that cancers, they don't occur in puberty. Most of the uterus cancers, they don't occur, and there is a more common problem in the females is anovulation, and that takes time and gets solved apne up. Okay, so endometrial biopsy is not done. Is it clear, Dr. Rahul? Let's take question number 17. Question number 17. Question number 17 is perimenopausal. What is metropathia hemorrhagica? It is perimenopausal anovulation. As you know, the ova, they get weak with age. Okay, they get weaken up with age. So as they get weak with age, so they sometimes they don't ovulate. Okay, so when they don't ovulate, the estrogenic phase keep on prolonging. Okay, and the patient comes to us with metropathia hemorrhagica, that is intermenstrual bleeding with and what is the histopath finding? Cystic glandular hyperplasia. So there is glands hyperplasia in the case. So it is always the histopath finding is Swiss cheese. Okay, Swiss cheese. Okay, so histopath finding is Swiss cheese. Because it is without atypia, it is simple hyperplasia without atypia. It is Swiss cheese appearance is simple hyperplasia without atypia. So what is the risk of this, Dr. Rahul? It is 1%. Okay, it is 1%. Very good. Next is next question is 18. 18 is adult woman has history of amenorrhea, hirsutism and acne. She is at risk of developing. So this is a case of PCOD. In question number 18, it is a case of PCOD. So this PCOD patient will have an ovulation. And so there will be infertility. Is it okay? Dr. Isra and Dr. Rahul, both of them, and Dr. Kritika, 3 of them have asked about the 19 number question. 19 number question is very simple. Let us study the treatment of menorrhagia. The treatment of menorrhagia is, first line drug is Trenexa. Okay. The second line drugs are OCPs or progesterone. Ethamsilate can be given, but there is no evidence for that. Ethamsilate can be given, but there is no evidence for that. Okay, it is a PYQ of FMG. Before that is 9 and 4. 9 and 4. 4 is Steen-Levendel syndrome is characterized by all except. Question number 4 is Steen-Levendel syndrome or PCOD. What is the another name of PCOD? Anovulation. Okay. Now there are multiple corpus luteal cysts. No beta, corpus luteum is not formed, Dr. Isra, here. No corpus luteal. Because there is anovulation, so no corpus luteum. Okay. There is no corpus luteum, only small multiple follicles which not rupture. Okay. Because as I told you today in the class, there is increased LH. Increased LH because the ova does not rupture. So there is increased LH. Increased LH cause theca cell hypertrophy. Theca cell hypertrophy. And this causes is increased androgen. So last one is right. Thick ovarian tunica albugina. Okay. Even if in the question it is written multiple cysts, you have to mark it as wrong. Okay. Even if in the question it is written multiple cysts, they are not it is not PCOD. It is polyfollicular ovarian diseases. Okay. What else is there? Beta, it is a misnomer. There are multiple follicles. There are not polycysts. There are polyfollicles. Okay. This name PCOD was given by Steen-Levendel. Do de diya to chal raha hai. What was given was it's going on. Let us see question number 9. Question number 9. Dr. Isra has asked. Nobody else has asked. Question number 9. I already told you OCPs, they have 4 generation. OCPs have 4 generation. Right? First 3 are testosterone derivatives. And they are given 1, 2, 3 generation because on the basis of the number 1 have maximum androgenic side effects. Number 3rd, they have least androgenic side effect. In number 2 comes levonorgestrel, and number 3 progesterone is desogestrel, and number 4 is, come on Dr. Isra, spironolactone derivatives. So it is drosperinone. So you have to choose drosperinone. If it is not drosperinone, then you have to write desogestrel. So you have to choose this. Right? So the answer is, since drosperinone was not in the option, so you have to choose desogestrel. Okay. After it is 21. 21. Scoring system used for Dr. Rahul, it is scoring system used for hirsutism. Scoring system for hirsutism is Ferryman-Galway. Beta, OCPs contains estrogen and progesterone both. Only progesterone will cause irregular bleeding. Only progesterone causes irregular bleeding and patient is not compatible with it. Okay? What is the side effect of progesterone pills? Progesterone pills, patient if forgets for 1 hour, progesterone pills don't act. They go into failure. So always COCPs are more preferable than progesterone only pills. This is question number 21. This is Ferryman-Galway system. Ferryman-Galway system. For hirsutism, it is Ferryman-Galway. And what is for the breast? What is for the breast, beta? Which staging is for the best? Tanner. Tanner staging. Is it okay? Next question is 37, 41, 44. 37. You need not to go into the details of 37 is a very important question and it can come in your exam. Sometimes these people, they go behind a topic. Okay. Sometimes now these days FMG favorite topic is Asherman. Okay. So let us study. Last time in the December 21, they asked what is the presentation of Asherman. The presentation of Asherman is, yes, amenorrhea. If amenorrhea is not there, then it is hypomenorrhea. Okay. Next, in the June 21, this June 22, they asked that what is they gave you the HSG image and ask you what is it. Okay. So now it is expected that they will ask you treatment. What is the treatment of Asherman? What you are seeing in the image is adhesions. What you are seeing in the image, they are intrauterine adhesions. Okay, intrauterine adhesions. Okay, so what is the treatment? Adhesiolysis. Okay, plus we will give high dose estrogen so that the endometrium proliferate. Plus we will put intrauterine pediatric catheter, Foley's catheter. Is it okay? So that once again the anterior posterior surface does not stick to each other. Okay. In the periphery practice here, we also put copper T. Rather than putting the intrauterine catheter, we put copper T also. Okay. And what is the treatment if this treatment fails? If this treatment fails, then the treatment is surrogacy IVF. We are in habit of saying that अगर ठीक नहीं हो रहा तो IVF कर दो. No, we have a habit. If any problem is not getting correct, then do the IVF. In this adhesions uterus, IVF cannot be successful. So we will go with surrogacy IVF. Surrogacy is always IVF. Okay. Dr. Isra, if the patient gets removed, if the patient gets normal, we will remove the copperty. Okay. If the patient gets normal, we remove the copperty. Any other question? (41) is prolactin is maximum after lactation, because once the lady is feeding his child, then there is a release of 2 hormones. What are those hormones? Yeah, 41 is once the female is doing lactation, 2 hormones are released, prolactin and oxytocin. They are not released before the lactation. Once the lady is feeding, doing lactation, then these are oxytocin is for the letdown, of milk, so that the milk which has been made, it comes out. It gives the kinetic energy to milk, moving energy to milk, move करवाता है वो milk को. Prolactin is for further lactogenesis, and this prolactin is responsible for lactational amenorrhea by suppressing GnRH. Okay? Dr. Bharat, is it okay? 44 and 67. Endometriosis, adenomyosis, and PCOS, fibroid, these all are hyperestrogenic condition. You can see today I have put the topic hyperestrogenic condition. Is it okay? So on histopath they will show the hyperestrogenic activity, Dr. Rahul. The last question of the day is, I think it is 47. 47 is, this is a case of ovarian chocolate cyst or endometrioma. It has a typical ground glass appearance. And what is the treatment of ovarian cyst? Chocolate cyst? If it is symptomatic, any symptom of endometriosis. What are the symptoms of endometriosis? Dysmenorrhea, all 2 Ds, dysmenorrhea, dyspareunia, infertility, menorrhagia. If any symptom is present, you will remove it, or if the size is more than 5 centimeter. Okay, so you have to do cystectomy in any of these cases. Is it okay? Is it okay? Any other queries? Please feel free to ask. ART. ART is artificial reproductive technique, or you can say artificial fertilization, or in vitro in vitro fertilization. IUI is not a part of ART. Okay, IUI is not a part, since in IUI there is in situ fertilization. Is it okay, Dr. Isra? ART includes IVF, or you can say in vitro fertilization, or ICSI. What is ICSI? Intracytoplasmic sperm injection. Okay, these are the two methods. Any other query? This is in the cytoplasm of ova. Hello Shahrukh, how are you? Any other query, Shahrukh? Dr. Shahrukh, any other query? Question number 32. Okay, okay. You are welcome, Shahrukh. Okay, see, this is Hair-End syndrome. What is Hair-End syndrome? You should know this is linked with PCOS. Okay, what is the basic etiology of PCOS? What is the basic etiology of PCOS, beta? Insulin resistance. Insulin resistance. Because there is insulin resistance, so there is, yes, so there is, because there is insulin resistance, so there are multiple small follicles which, beta, if it is asked in between two, then you have to tell PCOS. Okay, if the choice is between two, then you have to mark PCOS. This is increased hyperandrogenism, insulin resistance, acanthosis nigricans. Okay, please check that question. Please check that question if it has PCOS in the option or not. Okay. Metabolic syndrome occurs very late. Okay, it occurs after 40, 45, but PCOS occurs very early. PCOS occurs even in the age of 15 years. So if a choice is between the both, you have to choose the PCOS. Please check it. What choice was there? Do inform me on the Telegram. By this question, I just want to tell you that the skin manifestation, derma manifestation of insulin resistance is that the derma manifestation of insulin resistance is acanthosis nigricans, velvety skin. Okay. PCOS है, but it is a PYQ, beta. It is a NEET PG PYQ. It is a NEET PG PYQ, and the answer is PCOS only. Okay, it is for sure. The answer is that only. Any other problem? Any other query? Any other query? Can we close the session? Next class is at 6 p.m. Next class is at 6 p.m. contraception.